Hi, I'm Dr. Julie Steiner. Let's talk about the condition called amblyopia, where one eye doesn't see as well as the other eye, or sometimes it can be both eyes don't see as well as what they should. Now, before I go into talking about this today, let's talk about how you can connect with us. If you're local, you can call us at 618-288-1489. If you're not local, you can go to our website at visionforlifeworks.com and do one of two things. You can either click on the questionnaire and fill that out, or you can click on the schedule a consultation and schedule a consultation direct with me. And we'll talk about how we can help you. Now, let's go back and talk about amblyopia. Now, many times parents are wondering, why did I not know that my child's not seeing very well? How could it be that they've gone through a screening or a test or an eye exam and I had no clue that they weren't seeing very well out of one eye? Well, the simple truth is that kids don't know what they don't know. So, if that's what their vision has been like their whole life, it's not like they're going to come up to you and say, tug on arm sleeve, Mom, I don't see well in one of my eyes. By the way, I tend to turn that eye off and I don't use it for most of the things that I do. I only look with my good eye. They're not going to tell you those things because their vision is their vision and it's what they've known their whole life. So generally, they're not going to speak these things out to you. You might never know it. And if they're really good at all kinds of things, like, wow, they're pretty coordinated, they can do sports, or they can play on the playground well, they can throw a ball, they can kick a ball, throw a frisbee, they do lots of things really, really well. I had no idea. They're a good student in school. I had no idea, right? So it can be shocking sometimes to find out that your child doesn't see as well with one eye. And if it happens to be bilateral, with both eyes not seeing as well, usually there will still be one eye that's a little bit better or more sharp in terms of what it sees versus the other. But those are instances that you may never really know what's going on until all of a sudden someone says, hey, did you know that your child is amblyopic? Did you know that he or she doesn't see as well with one of their eyes or both of their eyes? And this can sometimes really be shocking to the parent, again, because the child's really not going to open up and say anything. For one, they don't know what they don't know. For two, sometimes they do realize there's something wrong with their vision, but they're a little concerned that that might mean there's something wrong with them, or that they could potentially be in trouble for something. And so sometimes they won't want to speak out about it. And thirdly, I guess, I don't know that there is a thirdly, really. It's those two main things that we see most often for kids. But sometimes, they just have concerns that they don't want to be incorrect or in trouble or wrong about anything. And so they're just kind of afraid to speak up, or they don't really know how to speak up. Sometimes they don't really know how to speak up because they don't know the words to use to describe that there's something wrong with their eyesight. So maybe that's our third one. All right, so what do we do about it? Is there something that we can do to actually treat amblyopia once we get kind of, that rubber stamp diagnosis? This is what it is. And the answer to that is yes. Amblyopia treatment is and can be one of the most successful types of treatment for vision-related problems that exists. But you have to have the right pieces kind of in order for making that outcome to be successful. For us, in our program, the two pieces that are very successful that work together, and you hear me talk about this all the time, but I love my Syntonics glasses. And very specifically, this filter is the one that helps the most in treating patients with amblyopia to help them to be able to see better. So that's one component. The second component is vision therapy, where it's a little bit more mechanical or more motor oriented, where we may patch the eye that's not the eye that's seeing well, and use the eye that's not seen as well and make it do more activities, very guided and specific activities that will help them to see better. It's not like put the patch on, wear it all day long, just do your normal stuff and wear it all day, wear it at school. That's kind of the old method of treating this that doctors used to do years and years ago. That's not the tried and true method now, and there's much better things that work. Again, mainly using syntonics to electrically trigger the brain to turn on the eyesight to that eye, and also the kind of motor or movement oriented patch and track and do some things with the eye. That's the second part of the treatment program. Those two things together, those two components are what's really powerful. And our goal for most of our patients is that they end up seeing equal with each eye in 2025 or 2020 in each eye. And if lens prescription is a problem, we also want to see the lens prescription be reduced so that they can see better. And not need as strong of a pair of glasses. Now, again, how can you connect with us? If this is you or your child or someone that you know, if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you can either click on fill out a questionnaire, or you can schedule a consultation online directly with me, and we'll talk about how we can help you. Now, if you like the video, hit the like button, but also be sure to subscribe to our YouTube channel and click that all bell so that you get all notifications from all of our videos. And if you think that this would be helpful, please pass it along to someone if you know maybe they don't see well with an eye or with both eyes. Maybe you could be the difference in someone's world. Thank you.